I think we're ready to get started then. Welcome everyone, our guests from HHS, from CoForma, all of our potential participants and judges of our Long COVID Healthathon. We will be talking today, first going through our agenda, doing some housekeeping, introductions, reviewing our schedule, getting into what Health Plus Long COVID Healthathon is and what it looks like, as well as sharing ideas and submitting design proposals. And then we will move on to our keynote address. So just a little housekeeping before we start. This session is being recorded. After this event, the video will be posted on longcovidcrowdicity.com for your review. And we will have the chat will not be open for everyone, but we do have Q&A. So everyone has been automatically muted. All questions will be answered at the end during a Q&A period, and we'll make sure we get to all those questions you submit. And questions can be submitted using the Q&A feature. If you're not familiar with that, it's two little speech bubbles down at the bottom of your screen on your Zoom. So who's talking to you right now? I am very pleased to get this started. My name is Marissa Parisi. I use she, her pronouns. I'm the account director here at CoForma, who's had the pleasure of working with our HHS partners on getting this Long COVID Healthathon launched. So we'll just do a round of introductions and I'll hand it over to my colleague, Ann Buechner.
Thanks, Marissa. Hello, everyone. My name is Ann Buechner. I'm Senior Director of Design at CoForma, and I will pass along to Frances.
Hello, I'm Frances Oliana. My pronouns are she, her, and I am Principal Manager of Design Operations at CoForma. I'm going to pass it on to Alyssa.
Hello, my name is Alyssa Legal. I use she, her pronouns, and I'm the Senior Visual Designer here at CoForma, and I'll pass it on to Felipe.
Hey everyone, my name is Felipe Gacharna. I use he, him pronouns, and I'm a Digital Media Manager at CoForma.
Okay, and I don't believe Oliver was able to join us today, but I will introduce our great partner over at Ensemble. Oliver Gerland and his team have worked with us closely on the Healthathon, and they've been a great partner. So from there, we will pass it, sorry about the slide changes, but we will pass it on to Allison O'Donnell. Allison, are you able to unmute? Why don't we give Allison a moment and we will pass it on to Ian Simon, and then we'll get back to Allison.
Hello. I think perhaps we do not have permission for mute or video, but I think you all can hear me. I am Ian Simon, he, him pronouns. I'm the Director of the Office of Long COVID. It's a pleasure to be here with you.
Thank you so much. And thank you for letting us know about your technical challenges. Looks like we have Allison back. We'll go back to her.
Hi, everyone. Allison O'Donnell, Deputy Director for the Office of Long COVID and HHS, she, her pronouns, and I'm handing over to Annalise Mobassery, if she can unmute.
Hi, everyone. It's a pleasure to be here. My name is Annalise Mobassery. I'm the health communicator in the Office of Long COVID. So excited to be here. And I'll pass it over to Kristen Honey.
Hello, Kristen Honey, and I lead a team called Innovation X, and that includes human-centered design and digital innovation. And with that, I will pass it over to Kathleen Carroll, who has led this work.
Hi, everyone. Thanks, Kristen. My name is Kathleen Carroll. I'm the lead designer at Innovation X in the Office of the Assistant Secretary for Health in HHS. Thank you.
Hey, fantastic. So I'm going to hand it over to my colleague, Alyssa, to go into the Health Plus Long COVID Healthathon.
Hey, Marissa. So I'm just going to walk us through some information about the Healthathon. So first, I'm going to start us off by reviewing the schedule and important dates of the Healthathon. So we're here at April 10th. You can see those arrows, I hope, at the live kickoff. I'm jumping back in time for a moment. The Healthathon submissions opened on March 25th. And on April 29th at 11:59 p.m. Eastern Time, design proposals are due. On April 29th at 5 p.m. Eastern Time, design proposal winners will be announced. And on May 3rd and 10th, there will be a live event, two live virtual events featuring a speaker. On May 14th at 11:59 p.m. Eastern Time, design prototypes are due. And on June 10th, the Healthathon winners will be announced in a live virtual event. Very exciting. So to understand the Health Plus Long COVID Healthathon, we first need to answer the question, what is Health Plus, right? So Health Plus is a program created by Coforma that applies human-centered design and research to cultivate solutions to the most pressing healthcare challenges we're facing today. How does Health Plus work? Health Plus is more than patient-centered, it's human-centered. Each Health Plus cycle is collaborative and places people and communities at the center of research and innovation. Health Plus surfaces high-impact health solutions in 3 ways. First, by breaking down silos. Health Plus engages communities affected by the health challenges we are aiming to create solutions for. It's often the case that these groups are not accustomed to collaboration on solutions in this way, and Health Plus aims to engage these communities, ensure they are active participants and co-creators in the research and solutions that may affect them. Another way it surfaces high-impact health solutions is by advancing health equity. Health Plus does this through human-centered design and research, and by looking not only at the big picture, but also at the individual experiences and taking those into consideration. And finally, Health Plus surfaces high-impact health solutions by building trust. Health Plus engages all communities impacted by the health issue at hand and includes these communities in the work in order to build the trust that is essential for innovative solutions. So the Health Plus Long COVID process, the cycle, as we call it, is conducted through a series of connected phases. In each phase, we learned from and worked collaboratively with people with long COVID, their caregivers, healthcare providers, advocates, and other subject matter experts. In the discovery phase, we worked closely with long COVID advocacy organizations to recruit a diverse community of participants in this process. These participants joined us for remote interviews, discovery workshops. They submitted audio diaries and virtual postcards, all to tell us about their lived experience with long COVID and hopefully to help shape our key learnings and objectives. In the validation and ideation phases, we analyzed and synthesized our research into tangible, data-driven findings that were reviewed by participants to provide feedback and confirm their accuracy. And finally, the implementation phase, which is where we are now, is a healthathon that aims to bring together people with long COVID, caregivers, advocates, subject matter experts, and more to create or elevate solutions that might improve the lives of those affected by long COVID. So what is a healthathon? Healthathons are health-focused innovation events with hackathon roots. They aim to bring together a diverse community of problem solvers. Healthathons transform insights from patients so that their understanding drives the development of new tools, action, and delivery with real-world impact that supports the long COVID community today. And from here, I'll pass it on to Anne.
Thank you, Alyssa. We're going to transition now into speaking more specifically about this healthathon, including its overall organizing question and goal, its tracks or its themes that you'll be brainstorming ideas around and hopefully submitting design proposals for, and some tips and tricks as to how to have a great healthathon, including information about how you can get involved and involve others while being mindful of the impact to your and others' energy levels. And so the organizing question, really the goal of this healthathon, is to improve the quality of care and life for those impacted by long COVID today. To help focus your ideas and design proposals, there are 3 tracks or thematic areas for which you can submit ideas or design proposals for. The first, people first. So providing solutions that create safe, responsive, and supportive conditions for people with long COVID to more fully engage in the world around them. Second, raising public awareness, so creating and disseminating educational materials to help increase the public's awareness of long COVID in order to build greater understanding and empathy for people suffering from it. And then strengthening community support for those living with long COVID. So this is designing resources that improve the quality of life and care for people living with long COVID. Resources can be for patients, caregivers, healthcare providers, clinicians, and other partners. You can explore all of these in more detail on the website, longcovid.crowdicity.com, under the Healthathon menu, and they're really intended to guide your digital solutions. You may notice that I said digital, which I'll pause for a moment on. So in this Healthathon, we are really seeking to focus on real-world, near-term solutions that help people today, as you heard in the challenge statement. So as such, we want to be digital first for its immediacy and ability to be used by many. Over the next 3 slides, I'm going to walk you through some areas of exploration for each of the tracks. These aren't meant to restrict you in any way. They're here as thought starters, inspiration, and reflection mechanisms. You can use them to start a brainstorm, build on them, or expand your own ideas, or you can go on your own. There are more detailed thought starters on longcovid.crowdcity.com. So for people first, you can explore ideas and solutions that build support systems for people living with long COVID, support youth, help people access assistance, and help people manage their healthcare needs. For raising public awareness, you might look to increase awareness of long COVID, support schools and workplaces to help them support people living with long COVID, educate healthcare providers to identify long COVID symptoms and create care plans, speed up diagnosis, and track and share data about long COVID nationally. For strengthening community support, you might look at solutions that build more inclusive spaces, create or simplify accessible paths to assistance, improve patient experiences, and modernize conferences and events to help organizers better design with people living with long COVID. Now I'm going to share some tips for a great healthathon. So use the Health Plus Long COVID Healthathon resources, which can be found on the resources and FAQ page of longcovid.crowdcity.com. All healthathon submissions must use the Health Plus Long COVID Human Centered Design Report and Long COVID federal data. We have linked to all of those on the website. You can start from scratch, or you can build on an idea you already have. And we really encourage you to engage with others in the long COVID community by joining the Crowdicity community, commenting on others' ideas, brainstorming with others, or creating or joining a team. After taking you through all of that, we do want to acknowledge that it's a lot of information and a healthathon can be a lot. And so we do want to make sure that folks can communicate and be mindful of the energy that an event like this can take. So leaning on Christine Miserando's spoon theory, this energy pie graphic is meant to help those with long COVID communicate and those without it to understand the cognitive and physical load required for folks with long COVID to complete tasks. And we've broken the pie down even further to show the levels of energy associated with healthathon activities. The low energy might mean a short event, optional participation, or requiring minimal to no participation. So this could mean sharing an idea or your story on Crowdicity for others to build on. Something that's medium energy might mean some participation, note-taking, or cognitive effort. This might mean joining a team or sharing your voice to support solution creation. And at the high energy end of it, we have more active participation, note-taking, and cognitive effort. And this could mean working alone or with a team to create a design proposal. These are, of course, notional. Everyone's energy is different, even day to day. But our hope is that these are useful guides that you might use in planning how you might want to participate. Right. Let's talk a little bit about the prizes. So this healthathon has a total cash prize pool of $25,000. Up to 15 phase 1 design proposal submissions will be chosen as finalists, each receiving $250. Up to 3 phase 2 design prototype submissions will be chosen as healthathon winners, each receiving $7,000. And HHS may also publicly recognize other promising solutions through non-monetary honorable mention awards. I'll now pass it to Frances to take you through how to submit your ideas and proposals.
Thank you, Anne. So I am going to give you a quick overview of how to participate in submitting your ideas and proposals. So we're going to add these links to the chat, but to get started, we have 2 sites for you to bookmark. First, visit the Healthathon Challenge on challenge.gov, where you'll find more details on the timeline, prizes, rules, judging details, how to enter, and you'll need to find and download the challenge entrant registration form from the resources section, which I'll talk about in the next slide. The next site to bookmark is the Challenge Hub at longcovid.crowdicity.com. This is where you'll be able to register, share your ideas, submit your design proposal, and engage with the challenge community. So as I mentioned on the previous slide, you must submit an official challenge registration form to participate in the phases of the healthathon, the official phases of the healthathon. So before you submit your design proposal, please make sure you've downloaded the form and filled it out. You'll upload the completed PDF to the attached files section at the end of the submission forms. A quick tip, after you filled out the form, make sure your information is saved. You can do this by closing the PDF after you've saved it and opening it again to make sure your details have been saved to the document. So after you visited the challenge.gov site and downloaded the form, you've got everything you need to visit the challenge directory page, which is under the Healthathon item in the Crowdicity site menu. On the directory page, you'll see an option to share your ideas and options to explore tracks 1, 2, 3, and submit a design proposal. There is a difference between sharing your ideas and submitting a design proposal to one of the 3 tracks. So we hope everyone who participates wants to share their idea or ideas to the community and engage with other ideas shared in the community. An idea is a short response to any of the 3 challenge tracks. Ideas are meant to start conversations, spark creativity, inspire and act as foundations for the full design proposals, inspire and engage teams to form. Ideas are not official entries to the Long COVID Healthathon. For those who are ready to submit a proposal to be formally judged and considered, you'll submit a design proposal through one of the tracks. A design proposal is an official entry to phase 1 of the Healthathon. Proposal entries have more requirements than ideas, and they are formally judged and considered for a prize. You must attach the challenge entrant registration form to your official design proposal submissions. The deadline to submit a design proposal is April 19 at 11:59 p.m. Eastern. So, to share your ideas, you'll select the Share Your Ideas option in the directory grid and enter the details for your idea. If you have any supporting images, you can also add those to the attached file sections. Then click Publish to share your idea with the community. As mentioned earlier, we encourage you to engage with the other ideas being shared in the platform. You might even find folks you could collaborate with to submit a design proposal together. Again, the design proposal is the official entry to phase 1 of the Healthathon. Proposals are formally judged and considered for a prize. These entries have more requirements, again, than ideas, so there are a few more fields to fill out once you select the track you want to submit. Enter those details and attach supporting images or media and the registration PDF to the attached file section at the end of the submission form. Then click Publish when you're ready to submit. I'm going to show this slide one more time, just to note the next milestone. The next milestone to add to your calendar is April 19, when all design proposals are due to be submitted through the Crowdicity platform. If you have any questions about entering your ideas or proposals, you can add those to the Q&A queue, and we'll address any of those at the end. But before then, we have our special keynote speaker to talk more about long COVID through the lens of the lived experience and how you can help. If you have any questions during the keynote, please add those to the Q&A as well. So we're excited to have Ian Simon, PhD, here with us today. Dr. Simon is the director of the Office of Long COVID Research and Practice. Previously, he was the Assistant Director for Health Strategy and Biopreparedness at the White House Office of Science and Technology Policy, where he led pandemic prevention and biosecurity policy priorities. Most recently, he was the Senior Advisor to the Director of the National Institute of Health's National Institute of Allergy and Infectious Diseases. Prior to working at the National Institute, Dr. Simon was the Assistant Director of the IDA Science and Technology Policy Institute, where he specialized in developing policy initiatives, including bioeconomy, STEM education, pandemic preparedness, biosecurity, and international science and technology cooperation. A virologist by training, Dr. Simon has also held health and science advisor positions at the U.S. Department of State and the U.S. Senate. Dr. Simon earned his Bachelor of Science from the University of Maryland and his PhD from Yale University. Dr. Simon, thank you so much for joining us. I'll pass it to you.
Thanks so much. Great to be here with you. I just want to take a few moments here with you all to speak with you about long COVID, what we know, what we understand thus far about this disease, what its impacts have been, and how you all can help with this effort. So from the work that we have done in collaboration with COFORMER and our colleagues in innovation here in HHS, one of the things that we recognized early on was that it was important to listen to the lived experience of those who are living with long COVID, those who are caring for those with long COVID, and to really listen to them to understand the impacts that this disease is having on their lives. This knowledge, as we've talked about already, was documented in the Health Plus Long COVID report, and it's really been central to our response going forward. So from listening to them, what we know is that long COVID is not one singular condition. It is a broad set of signs and symptoms that patients are dealing with 4 weeks or more after the initial COVID-19 infection. The interim working definition you can see here, but what we can tell so far is that it does represent potentially overlapping conditions, likely with different biological causes and different underlying risk factors. But what is true is that while we know that it can affect people's daily lives, it can even be severe and life-threatening. It is one of a group of conditions that we understand to be infection-associated chronic conditions, such as ME, CFS, fibromyalgia, Lyme disease, and autonomic dysfunction. We, as you know, because of the COVID-19 pandemic, are keenly aware now that an infection, an acute infection, can lead to associated chronic conditions. But these types of chronic conditions have been around for decades, and they, in many ways, are still mysteries to us. Early on in the government's response to long COVID, the National Institutes of Health started a pretty robust initiative called the Recover Initiative, where one of the first things they did was to look at the symptoms and conditions from over 2,000 individuals living with long COVID. And with that work, they published it in the Journal of the American Medical Association. They were able to see some of the most common symptoms fell into 5 general areas. There's gastrointestinal, fatigue. The most commonly reported symptoms include those like post-exertional malaise, which is a severe fatigue that follows overexertion. Those periods of overexertion are usually followed by a crash the day or a few hours later. And other commonly cited conditions included brain fog, which is what patients commonly call the inability to focus or remember. Now, I've mentioned this before, the biological cause of long COVID is not exactly known, but there are multiple hypotheses out there, each with a body of evidence, some from small studies, some from large studies, some that cite immune dysregulation or microclots. And it is probably the case that these do not act alone. They might have a combination of some of these causes leading to long COVID conditions. Compounding the mystery is the fact that we also don't have specific diagnostics for long COVID. There currently is a clinical diagnosis, which is one of exclusion, and one in which they are attempting possible causes that might lead to similar symptoms. The current research efforts underway are those that are meant to really understand the biology of long COVID, hopefully elucidating biomarkers that can help with getting us to the development of diagnostics. And while that work is going on, though, we do have a little bit of information about some of the risk factors that underlie long COVID. It seems that people who are aged 35 to 60 are most likely to experience long COVID. It is also seen that women are more likely than men to experience long COVID. Those who have had severe cases of COVID-19, especially those that have to be treated in the ICU, are at increased risk of long COVID. And it's true that there are some pre-existing conditions that are still being elucidated that might increase one's risk of getting long COVID. But it's through listening that we've learned that people with symptoms and conditions with long COVID often have to find a way to live their lives. They have to show up in their communities, in their families, with a much altered lifestyle, with a much altered loss in quality of life. And so while it's heartbreaking when we here in the Office of Long COVID hear those stories, it's also incumbent upon us to understand how big the problem is. And we're still working through that, but early statistical analyses by the Centers for Disease Control have shown us that it's somewhere between 3 and 6% of adults currently have long COVID. That translates to 10 to 20 million Americans right now are dealing with long COVID, with a quarter of those folks reporting significant activity limitations. So with that type of burden, what is to be done? While it's true that we don't know the underlying cause and we don't have specific diagnostics, we also do not have specific treatments for long COVID. We do have some existing therapies, some of which work on some symptoms, but those therapies don't work on all of the symptoms. And it's also true that the ways in which long COVID patients receive care is often through clinics that have multidisciplinary treatment. I say often, but that is even dwindling as these specialty clinics, that many of which were stood up in 2021 and 2022, are losing funding, they're losing support, and many of them are closing today. Primary care also plays a critical role, as these specialty clinics, maybe that used to be open, or closing, or patients are in areas that don't have easy access to these clinics. And so it's through the identification and clinical diagnosing of these complex post-infection chronic conditions that primary care services are facing an uphill battle. They are already strained from workforce shortages. They're already strained from scarcity of resources, and now they are trying their best, but they're met with many significant challenges when it comes to conditions like long COVID. Ideally, people who experience long COVID will have a treatment journey that looks something like this, where they experience symptoms and they can get the care they want, and they can have access to diagnoses and effective treatments. But unfortunately, the reality is what we're seeing all too often are these pain points that are popping up throughout the treatment journey of many of these patients. And so it's some of these pain points that, as shown on this slide, could be some really good potential targets for innovation efforts like the ones here and the ones that hopefully you all will be tackling. In addition to those challenges with the treatment journey, what the Health Plus report also showed us was that there are opportunity areas to help improve people's lives. The framework shown here, the opportunity framework, we think of as sort of 4 ecosystems that are distinct but often intersect or overlap directly or indirectly to influence a person's long COVID experience. So it's here that we believe that there might be solutions in the innovation ecosystem that might focus on treatments, tests, improvements in a care pathway for people living with long COVID. It might have to do with something like supporting advocacy work or leveraging technology to educate physicians and the public. Within the assistance ecosystem, one might focus on providing people living with long COVID with support and assistance they need to focus on their health, or to help schools and workplaces support those folks. Within the healthcare ecosystem, we might be able to focus on the resources and human-centered infrastructure that's needed to support people living with long COVID, such as increased access to disability or other assistance programs as a warm handoff from healthcare clinics and healthcare settings. And finally, it's within the public ecosystem, there might be opportunities to focus on raising awareness and building support networks and sharing the accommodations that are already in place on a small scale and scaling them up on a wider scale. So in addition to the Health Plus report, which is linked here, we have several other links and resources that can help enrich your understanding of long COVID. So I want to thank you for your time. I want to thank you for allowing me to be here. I want to thank all of you for rising to the challenge and for working together to find solutions for people living with long COVID. So with that, it'd be great to invite you all to have any questions. Thank you.
Thank you so much, Dr. Simon. We so appreciate your insights and presentation. We did have one comment submitted, and I'll read that to open up the floor for more questions. Please remember that the Q&A is open. You can use the Q&A function at the bottom of your Zoom screen. And Dr. Petrino from Mount Sinai, who's actually participating as a Healthathon judge and is an expert in this field, wrote a comment in our Q&A, which I'll read. He said, "Hi all, I'd like to point out that although CDC guidance recommends ruling out other conditions before making a long COVID diagnosis, we don't typically discuss long COVID as a diagnosis of exclusion. There are diagnostic criteria, and onset of these symptoms are temporarily linked to an acute SARS-CoV-2 infection." I hope I got that correct, Dr. Petrino. I don't know if you had a response to that, Dr. Simon.
No, I mean, Dr. Petrino is quite correct. There is CDC guidance, and then there are, models of care that are happening there. For instance, where Dr. Petrino is, I do think we want to be careful in that we are not saying that a SARS-CoV-2 infection diagnosis is prerequisite for being evaluated for long COVID and even having a long COVID diagnosis. So. We've seen many folks who say that either they're not quite sure if they were infected with SARS-CoV-2 or, they don't have the paperwork to prove that they were. That is not in any way a prerequisite for assessment for long COVID or diagnosis for long COVID. So I think both of those are correct.
Thank you both for your insight on that. We have another question that just came in. From the data.gov, is there any specific data set we need to use? I would pose that to our colleagues at HHS. Also to the CoForma folks, if they have an answer to that question.
I can give a response. For the complete kind of rules and guidelines for your submission, I'll default and point you to challenge.gov because that has kind of all of the specific language. But there's not one specific data set that you need to use from data.gov. I think that our recommendation is that your submission references federal data related to long COVID.
Thank you so much, Kathleen. And I'll also note to folks who have an interest in that answer that Felipe has posted the challenge rules and the link in the chat, so you can take a look. That was the last submitted question, but we can pause for another moment to see if others would like to type a question. We're happy to answer the questions live. It can be anything about the challenge, a question to our speakers. We're happy to answer them now. Thank you. Another question came in. It says, our team planning to symptoms-related web application. We couldn't find any proper data set in your suggested websites about long COVID. Can we use other resources from Twitter or other resources?
I'll say that your submission can include references to other resources, but it also needs to include references to the federal long COVID data.
Super. Thank you for that answer, Kathleen. Other questions?
I'll just reiterate out loud something that Felipe put in the chat. It's the official rule language is submissions must reference facts about long COVID from federal data sources or peer-reviewed articles.
Thank you for that, Kathleen, and for your quick work, Felipe, putting that in the chat for everyone. Other questions? And just know for folks that are interested participants in the Healthathon, this won't be your last opportunity to ask questions. And we do recommend you check out the websites that are all posted in the chat so that you can familiarize yourself with the challenge. And there is a way to contact folks related to the challenge through our resources. But we'd love to answer any live questions we can right now. Okay, a new question. Okay, I think we may have just answered this, but I will ask it live. The data set that we are looking at I'm sorry, let me start again. The data set that we are looking at is post-COVID conditions CSV file, but that file only has 13,726 rows, which is less data. Kathleen, is that something you can answer?
I don't know. I think that the same guidance applies, that your submission has to reference long COVID federal data sources or peer-reviewed articles. So if there is, if some of the resources may not be fitting what you need, you may just need to do a little bit more digging to look to see if there is a different federal data source or a peer-reviewed article that maybe meets your needs more appropriately.
Okay, thank you for that, Kathleen. And then there was a website posted here with the data set, and I can perhaps share that with Kathleen after the session. Other questions? Thank you so much for the submissions thus far and for the comments. It's very much appreciated to get these questions and comments because it's exciting for us because it seems like there's enthusiasm out there for participating in the Healthathon. So we're really glad about that and really look forward to hearing your ideas. We have a few more minutes. I don't want to keep folks longer if our questions slow down, but also want to leave enough time for folks to submit them. Okay, another question. For the phase 1 submission, if we are thinking of a digital product, would you want to see any visuals like user flows or sketches?
I can hop in here. You're totally welcome to submit any visuals that you like with your design proposal, but and I would ask you to refer to the actual submission form to see what exactly is required. But overall, the design proposal phase is a lighter phase than the prototype phase, which would be more involved and have more of those assets associated with it. But sorry, that was a long way of saying, like, yes, please do submit those.
Great, thank you so much, Anne. We have another question. Is there an official way of forming a team, or does it come down to who submits the proposal?
I'll ask Frances to chime in if she has more to add, but there's like no official way to join a team. So really what we are hoping that the way that people use the Crowdicity platform is to seek out others in the ideas section and even the design proposals sections to find like-minded folks that you might be interested in teaming up with. And in terms of like the actual submission, so you'll find with the HHS registration form, there's plenty of room to list the other people who are on the team. So you have like primary submitter, but then plenty of room to name the other folks who you're working with.
Yes, and you can also tag those folks. So we do have a couple of submissions that have been added to the share ideas section. So if you were looking for a team, you could go to that section, and all of those ideas are open to comments and conversation. And there are some conversations that have started. So just check those out and then see if your ideas align and form a team. And then you can submit a design proposal together. I do believe you do individually each have to sign a form from the challenge.gov site, but you would just upload those all to the attached files section. And yes, you can, and again, you can tag other folks that you have met or collaborated with from the site.
Great. Thank you, Anne and Frances, for those answers. I'm going to do a last call for questions. I don't want anyone to have to type too fast, so I'm just pausing for a moment to let folks get them in there. Okay. Another question, do we need to have our designs validated by engineering for feasibility? Great question.
No.
Go ahead.
Seems like Anne said no, and Frances was going to fill in the rest of that.
Yeah, no. I think as the ideas are chosen, there are future opportunities to engage with engineering, but this is really about ideas that can be done, but that's not the focus for this specific healthathon.
If you have a look at the judging section on the Crowdicity site, you'll see if you go to the bottom of the page, there is like a full rubric in terms of how the design proposal will be judged. And so feasibility, so do you have to specifically speak to an engineer? Maybe not, but feasibility is a part of these near-term real-world solutions. And so that is one of the aspects that the judges will be looking at.
Great. Thank you, Frances and Anne, for those answers. And just a reminder, Felipe continues to add resources to our chat and has included more about judging to give you more information about the question on engineering, design and engineering. Okay, and next question. Does every team member have to submit the idea, or team lead from the team has to submit the idea proposal?
Yes, you can have one team lead submit the idea proposal, but if you are all registered to the site, just make sure that you have tagged everybody in the submission, in the design proposal submission, and there is a field for that.
Great, thank you, Frances. And thank you for those who are submitting questions. We're hoping that we answered them sufficiently for you, but also it's great to have them for other prospective participants. So thank you all very much. Okay, so maybe a last call for questions. They seem to keep coming in, which is wonderful. Okay, so I think it's slowed down enough. Oh, no, one at the very last minute. Thank you very much for this question. Does every team member submit a registration form?
I can take this one. No, but the registration form contains information about every team member. So your team will be made kind of concrete by you submitting the registration form. And the registration form ensures that we have all of the information necessary to pay out the prizes.
Great, thank you, Kathleen. And Felipe has put a link to the find and download the HHS Challenge entrant registration form right there in the chat, so you can grab it. There is another question. Is there information about the judges? I can answer that one. We do have an incredible panel of judges. They are on the Crowdicity website. Quite a few of them have joined us today and will be participating in the judging rounds of all the submissions. Felipe, of course, who's done a great job keeping track of all this for us. Leah, who submitted that question, there's a link right there in the chat for you. Last call for questions. Seems to work, that strategy. I keep getting more questions.
And Marissa, I think Divya also had a question. We have an idea overlapping category 2 and 3. Is that okay?
Great catch. Thank you so much, Allison. So I'll just repeat it again. We have idea overlapping category 2 and 3. Is that okay?
Yeah, so, oh, go ahead. I was going to say in the submission form, you'll find there's an opportunity to name kind of the primary category and then pick a secondary category as well if your idea is straddling two.
Thank you, Anne. And again, thank you, Allison, for that catch that I had jumped ahead on that question. Okay, another question. This might have been answered, but is this open to those without a health science background or experience with long COVID? I think we're all nodding because sure is. We would love to hear feedback, ideas, anything from really anyone who has an innovative perspective on this topic.
Yes, and feel free to share this information in this webinar with them or this meeting recording with them so that they can participate, so others can participate with those within your circles. Everyone's welcome.
I'll read this question. I'm not sure I fully understand it, so but we'll just see if maybe others do. Is there a schedule posted for the lives? And Allison, I think you would like to answer that question.
Well, I think it means the live events like this. This is a live event.
Super, thank you.
Yes, we have the schedule. I think the schedule will be posted, but it is also, we also have a slide for that. And I think we are posting the deck so that you can reference it afterwards, but we do have the events. Alyssa talked about it, so she could probably pull it up, but they are listed as well as the due dates and then other milestones within the healthathon.
Yeah, if it's helpful, I could give a brief overview, or if that answered your question, let me know. But otherwise, I can give a little overview right now. So April 19th, the design proposals are due. April 29th, the design proposal winners will be announced. And then May 3rd and May 10th, there are those live virtual events with speakers. May 14th, design prototypes are due. And then June 10th, the Healthathon winners will be announced in a virtual event.
Thanks so much, Alyssa. Super helpful. We still do have some time to answer questions, and it's great that they keep coming in. So
Could I just add something?
please, Kathleen.
Awesome. So earlier I mentioned like the registration form in Teams. I just wanted to add that you don't necessarily need to be on a team to submit a solution to the Healthathon. You can submit as an individual, and that is also totally valid. And just wanted to make that clear. So don't feel like if you aren't able to get a team together, but you still have a project that you're passionate about submitting, we would like to see that as well.
Really appreciate that, Kathleen. Thank you for adding it. And as a reminder from Felipe, this session is being recorded after today's event. The video will be posted on longcovid.crowdicity.com. So you'll be able to review the timeline there as well. Okay, the floor is still open for questions. Are there all-day events?
Each of those events will be about the same length as this one. And so looking at about another kind of 45 minutes to an hour.
Great, thank you, Anne. And we'll have the schedule of events posted on the longcovidcriticity.com website for your review as well. And thank you all for your interest in all of the upcoming events. We're excited to have you all again. Okay. It seems like we were having a few people drop off the call. Oh, wait, there's one last question. Every time I think it's time to wrap up, there's another question, which is great. Would it be okay to focus on our app on specific population like LGBTQ, or should it aim to support the general public? Great question.
I was trying to find my unmute button. Let me know if anybody else wants to jump in here. But one thing I do want to point out is that if you go to the Healthathon page on Crowdicity, there's specific language around, so when coming up with your solutions, consider how they will reflect the needs of diverse communities, especially those disproportionately impacted by the effects of the COVID-19 pandemic. Those disproportionately affected by COVID-19 include people of color, LGBTQ plus individuals, disabled individuals, children, older adults, and those living in rural or tribal regions. And so I hope that answers your question.
Yeah, and it seems like the simple answer is yes, and then there's lots more information on our website. And again, our terrific behind the scenes person, Felipe, has posted a link directly to that for the person who answered the question in our chat. So it'll link you right to that. Other questions? Okay, usually if I start thinking about wrapping up, more questions come in. So I'll start doing that and see what happens. But I just want to say thank you to everyone who came to our call today, really on behalf of Coforma and our partners at HHS. We are very excited to be launching this work with all of you and to hear your incredible ideas for innovation in this space to support the long COVID community. We hope you got a lot out of the session and have all of the resources needed to jump right in and share your ideas. And please also, as our team has said, share this with others because we would love to encourage as many participants as possible. We know we have a lot of work to do ahead of us for the long COVID community, and we're really looking for as many innovative ideas as we can get. So with that, I will wrap up. The recording will be on the Crowdicity website, so you can review it. And just thank you all so much for your time today.